It's fall, which means football, sports, kids back in their games. We have injuries that are happening oftentimes without the coaches even knowing it, because maybe like myself, you just want to get more time in the game, right? And so today I want to quickly talk about concussions and really what to do and maybe what the proper avenue or questions to ask, right? And so a couple quick stats when it comes to concussions. We found that in, this is a 2018 article published in the Morbidity and Mortality Weekly Report, said when it comes to concussions, it's a brain injury, a traumatic brain injury. Number two, among high school athletes, there's an increased susceptibility because of course, the sports. In fact, in 2017, 2.5 million high school athletes, right, received a concussion, and 40% of those were unknown to their coach. This is troubling, right? Because this might be your son, your daughter, this might be yourself, you might be seeing this. What are some common signs or symptoms? Often very similar to like a whiplash injury. You might have kind of dazed vision, you may have difficulty sleeping, you may be tired and lethargic all the time. Your friends may notice that you have a slight change in personality or mood, right? Of course, there may be pain. There may be a peripheral pain where the pain kind of radiates into a shoulder, a scapula, down into your hands, in your arms. As with all injuries of the head and neck, it's a great idea to get an assessment by a local provider to see are things moving the way that they should be? Are they working like they should be? So when it comes to the cervical spine, there should be a nice curve in it. The head should be over the shoulders. And then when you look down, all the bones should move. When you look up, all the bones should move, right? When these things get stuck, it's called subluxation. It irritates that central nervous system, again, leading to some of those common symptoms. What the research tells us is that the sooner that you start working on patients that have suffered injury to their head, to their neck, right? Management of these, it says, has been well documented that injury and dysfunction to the cervical spine can result in numerous signs and symptoms, synonymous with concussion. And skilled manual spine-related assessment and rehab of the cervical spine should be a staple for addressing these symptoms, right? In other words, get to the chiropractor. If you have a concussion, if you're suspecting that a loved one has a concussion, an injury from a sport, perhaps football, soccer, heading the ball, whatever it may be, get them checked out by a chiropractor. Again, I'm Dr. Joe Utash, Wellness Key Chiropractic. If you have more questions on concussion, how a chiropractor can help, please give us a call.